pro VBAC and supportive, and then IMC, the main hospital downtown, also has groups that are supportive of VBACs. In fact, I walked into the main hospital down there, and I said, well, I came down to talk to the head nurse about VBACs, and she says, oh, we love VBACs. And I was like totally taken aback. Now, that doesn't mean that you're not going to have a problem, but those hospitals do try to be a little bit more open-minded about it. And then, of course, we have Chris up here who does home births with VBACs. And I think that the most important thing is that you have to realize, and this is the hardest part, is you have to realize that no one can operate on you without your consent. And, you know, if that had been my daughter that, you know, had the doctor who wasn't going to give the VBAC, I would have told her to get dressed. If the baby looked good, I would tell her to go get dressed and we'd go to a different hospital. I mean, you know, it's a choice for you to walk out. They'll say, well, you have to sign out against medical advice and all these other things, but they cannot keep you there. They cannot do surgery on you without your consent. And so somebody needs to explain to you in a way that you understand why whatever is happening to you is happening to you.
Thank you. Now, Jessica, I want to ask you more on an emotional level and personal. What advice would you give a mother who's just beginning her VBAC journey?
I think the most important thing for a woman is her support team. I can't say enough about having a provider who believes in what you're doing and who is going to support you, who is going to allow you those things that you desire, and is going to help accommodate you and help you achieve them. And I think next is educate yourself. Learn. You can't say I'm going to have a natural birth and never, what does that mean? What is that like? What is your body going to go through? How are you going to prepare for that? What are you going to do when you're in pain, when your back hurts, I think it's important to practice, right? You don't go run a marathon and never train for it. I think it's important to practice relaxation, and I did personally. I know it was different for me because I couldn't find a provider. But I called every hospital and I asked to speak with the head nurse. And I asked, do you have doctors? The head nurses are the ones who deal with the doctors. So I do, call and find out, is your doctor supportive? Is your doctor the doctor that pulls the bait and switch where, yeah, we support VBAC, and then here you are 37 weeks or coming in labor and you're getting a different story because the baby's too big or, many of the reasons that they give. And to believe in what you're doing. Fear is normal. You have fear, you go through fear, you doubt yourself, you doubt what you're doing. Educate, learn, keep reading, keep talking to people. And if there's people who don't believe in what you're doing, I think it's important to verbalize to them that you are doing that and it's important to you, and if they don't agree, that's okay, but that you don't want to hear about it. It gets to the point that you have to be able to stand up for what you're doing and tell people enough's enough. I don't want to hear it. This is what I'm doing, and after the fact, you can rejoice with me.
I think the other thing is that if you feel like people are being invasive, like head nurses, if you call them and they say, well, we can't really give out any names, or, then that's a mark. That's a heads up that there's something wrong. And if doctors won't give you their numbers of how many C-sections they do and how many VBACs they do, if they don't bring it up in the very beginning of the pregnancy, sometime in the first 3 months, and say, you've had previous C-section, what are your plans? And if you say, hey, I'd like to know more about VBACs, then there should be a very open discussion that you recognize that you're being acknowledged. And just like, I was just reading today in some of the literature that's out there, I mean, there should be a plan that if you have previous C-section for, say, 7.5 pound baby, and you come in labor at 35 weeks, and they can't stop your labor, and you have a 5 pound baby in the correct position, you should be allowed to labor. And you need to mentally be prepared for that. You need to say, if I come in labor, I want to have my VBAC. And if they say, hey, we are planning to do a C-section, and you come in labor and you're 9 centimeters, don't have the C-section. I mean, you're so close to delivering vaginally, you should say, hey, we're going to go for it. And that's the discussion that you have with your doctor. I mean, that's a good question to ask. If I come in labor and I'm 9 centimeters, what are you going to do? And they say, well, you've had 3 C-sections, you have to run back and have another C-section. And say, that's not what the American College says. We need to reevaluate what happens with every patient that comes in. And I had this discussion with one of my patients who had 3 previous C-sections. And, I said, if you come in spontaneous labor, depends on where you are in labor, and we might be able to let you deliver. Well, my partners in the hospital just got totally freaked out, saying that I was offering this patient an alternative. And it was like, no, I'm just telling her what her rights are. But they said, no, you were encouraging her not to come into the hospital until she was in advanced labor. As if I'm going to go to her house and check on her and tell her that she's going to come in. And so if your doctor's not having these discussions and saying, hey, if you come in premature labor, we're going to let you deliver, then heads up, this person probably isn't a big fan of you delivering vaginally. And that's the big question. So
I think you can't leave informed consent up to your doctors, your providers. I think it is so important that you inform yourself.
There's no such thing as true informed consent as far as hospital VBAC consent forms go. They are slanted to the risk and not to what the benefits are. And I had 2 scheduled cesareans at 38 weeks. I was not educated. I had no idea what I was doing. I had no idea what the risks are, and they were not explained to me. It wasn't until I took until I realized I was going to have to do the education myself, and I read the books that I needed to, and I truly became committed to the idea of a vaginal birth, and realized it was a fight, and it shouldn't have been a fight. It should not have been a fight. But it wasn't until I did the education and the research myself that education did not happen when my doctor or the hospital handed me the cesarean consent form and I signed it. There was no education happening there. Nobody said to me when I scheduled my second cesarean that if you don't at least try to have this baby vaginally, you may end up having all your babies by cesarean. I had no understanding at all of what the risks were, either to myself or to the baby. We talked about the risk of uterine rupture to the baby. We really haven't discussed the risk of cesarean to the baby. Babies born by cesarean are less likely to be breastfed, which has lifelong health implications to baby. Babies born by cesarean have higher asthma rates, higher autism rates, respiratory problems at birth. They have higher NICU stays and longer NICU stays. They have a chance of being cut by the scalpel. They have a risk of prematurity when you're scheduling a cesarean at 38 weeks. Well, you may not be as far along as you think you are. And so having a cesarean does not guarantee a healthy baby, and it certainly does not give you a healthy mother. You have a mother who's recovering from major surgery, and there are health risks to that. Oh, and I wanted to say too, McCady is the only hospital that has a higher than 10% VBAC rate. Now, Ogden Regional and Davis have a less than 10% VBAC rate.
Interesting.
And that is, is it 90% of women who have a first cesarean go on to have a repeat? So you're looking at less than 10% of 10% of women who have an initial cesarean. That is a very small amount of people. That is horrible. It should not be like that.
No.
But women can have a VBAC in a hospital. The hospital is not the enemy.
No. You have to be committed, you have to find a care provider that's supportive, and you have to do your research, and you have to be committed to it, and know what you need to do. Always listening to your own intuition as a mother.
Really quick, I just have to say this. One of the most important things that anyone ever told me, and it still is the most important thing I failed to tell other women, is there's no guarantee in birth. You can plan and you can learn and you can educate and you can have a supportive provider, and you could end up on an operating table. And I mean, I think you have to walk away knowing that you did educate yourself and you did have a supportive, and there are people who to help you through that healing physically, mentally, emotionally. But there is no guarantee in birth. You can end up with anything.
I mean, the ultimate goal is that you want to be healthy yourself. You want your baby to be healthy. You don't want to be inflexible in your thinking, but it has to make sense. And that's the thing that women don't allow themselves, is when there's alarm bells going off that there's something not right. They don't have sort of a resource. But don't be afraid if you choose to go to the hospital and you feel confident. I mean, I had a patient who had 2 previous C-sections, and her insurance was telling her that she had to go to Ogden Regional or Logan. Well, Logan doesn't do VBACs, and then at Ogden Regional, if she had stalled in labor, they wouldn't give her any Pitocin if she had 2 previous scars. And that's an important thing to realize, that if you go to Ogden Regional, they have a rule that says 2 previous scars, you're not allowed any Pitocin if your labor arrests. And so I got approval. I challenged the insurance company, and we got approval for her to go to the university because they would give her Pitocin. She went down and she was in spontaneous labor. She worked with the doula. She showed up at 5 centimeters. She never progressed. And but she wouldn't let them break the bag of water. Oh no, she did allow it. She had broken her bag of water spontaneously. And so I went in to see her. I wasn't practicing at that time. And so I went in just to give her support. And I said, you really need to give them permission to give you Pitocin. And she says, well, Pitocin is going to increase my risk of uterine rupture. And I said, no, it's okay to take. It theoretically does double your risk for uterine rupture, but if you're 1 in 1,000, then you go to 1 in 500. So at this point, you need to get some Pitocin. And 2 hours later, she delivered vaginally, went home the next day before I even had a chance to go visit her. And so, but see, if she had been here, she wouldn't have gotten the Pitocin. And so you need to be sure you understand all the rules of the hospital, and they don't advertise these rules. They don't say, hey, 2 previous scars, you have a snowball in hell's chance of delivering vaginally, but go ahead, come on in. But don't be afraid if your body needs help. If you need that epidural, just make sure you have a doc who's willing to go through the steps to protect your baby and to make sure your contractions are strong enough, and will give you Pitocin and will give you time. I mean, it's always about time. And as long as you're healthy and you're happy and the baby's healthy and happy, you can wait almost forever. I mean, I had a patient who was in labor for 48 hours, induction. She ended up delivering vaginally. You just have to be very patient and keep the baby happy. So.
Which all goes back to trusting your provider.
Thanks, you guys. I'm going to ask 2 more questions, and then we'll come to the audience and see if we've forgotten anything. But I want you each to answer just like super brief. I know Chris can do that. Just kind of like a 1 word or 1 short snippet. But what do you feel is the major stumbling block for attaining a VBAC? And we'll just go down the line, and then I'm going to ask 1 more.
Major stumbling block. To me, it is, I guess it's probably the provider. I mean, we've talked about that. If you find somebody that's supportive, you probably don't have the stumbling block. But if you don't do your research and find somebody that is supportive, then you're probably not going to have one. So, if you really want one, that wasn't more than 1 word.
It's okay. Go ahead.
I think fear can be a big one, and I think the fear can come at you from all directions, and so yeah, when you are able to face that, when you're able to defend that to others, when you're able to deflect it from the institution and care providers, you turn that fear around to trust in your own intuition and your own wisdom and knowledge, and you go for it.
I agree, and I think hospital policy and protocol is huge. I think being tied down to a bed on monitors is huge to the process of labor moving along. A head block instead of an IV, so all those beautiful, wonderful things that can be important, but not always necessary.
I think it's all about self-empowerment. I think you need to say, I'm smart enough to understand all the numbers. I'm smart enough to know when I'm safe and when I'm not safe. You need to understand that there are no guarantees in life, and that, something bad can happen to anybody at any time. But the numbers for VBACs and trials of labor are all in your favor to being able to deliver vaginally. And so you have to work hard at having a healthy baby and staying in good shape and finding the right facility for you to deliver at, whether it be a home birth or whether it be at the hospital. And, and always, I had a patient who transferred to me with her first baby because she went to a midwife who told her, well, you're 41 weeks and you need to be induced. Well, she didn't want to be induced, and the midwife said, well, I'm going to not take care of you. If you're not going to listen to my rules, then I'm not going to take care of you. And she walked away and she came to see me, and I said, well, we'll monitor the babies really carefully, the baby, and I will allow you to go into labor. I will allow you to go to at least 42 weeks, and I think she actually went to 42 and a half weeks and came in spontaneous labor and did fine. But it's all about understanding the numbers, and if you're afraid of a VBAC, don't let anybody force you into having a VBAC. And if you're afraid of a C-section, don't let anybody force you into having a C-section.
Thank you. Okay, last question, and then we'll see if anybody has any questions out here. One bit of advice for expecting couples. I don't know if there's a few in here, but what's your one advice you have to give to a couple? If you just see them and you say, I have one thing I can tell you, what is it?
Come up with a billion questions. listen to everybody and all this is what I tell everybody. The ones that you're asking me today probably are really important to you, but the ones that are going to be more important is all the what ifs that people bring up. So those are the ones that you need to come in and ask, what if, what if, what if?
It's huge. Yeah, I don't think I have anything to add. There's too many things.
Second opinion,
Oh.
do not be shy. Even if you're in the hospital in labor and your doctor is telling her you have to have the C-section, you ask and say, I need to talk to somebody who says pro VBAC, and have that person come in and talk to you and explain what's going on, and if it makes sense, then you will feel better about it. But don't be shy about changing providers anywhere, anytime, if you don't feel like things are going the way they should. If your antenna are up, pay attention to it.
That's always my speech when anybody comes in to interview me. It's always that. It's you that we're doing this for. It's not us. So you have to make that choice, and my ego's not big enough to I don't mind hearing you're not the one for me. I like it when people make those choices.
I would say you always have options. So if it's changing doctors at 36 weeks or 38, or when you're in the middle of labor, then do it. This mom in the hospital, I so encouraged her and her husband to leave. I'm like, go to a different hospital. It doesn't matter at this point. Your baby's fine. You are fine. And she could have signed up and left, and that was an option for her. She did not choose that, and that was really hard.
We've had fun with that. We had a mom, when we first opened up the birth suite upstairs, she was on her way to Ogden Regional in labor, but she had heard that we had opened up, and she wasn't far enough in labor that she couldn't stop. I thought that was cute. But anyway, she came in and looked around. She said, well, I'm staying here.
Okay, does anybody have any questions that I haven't covered, or they haven't covered? I covered everything? It's covered? Okay, hold on, I'll get a microphone. Actually, I'll just let you use mine.
I wanted to ask if you could give advice to a doula who's supporting a woman who is trying to have a VBAC, what would you say to her?
Do you want someone in particular? Okay. Who wants to answer? A
What you
doula.
would say to a doula who's supporting
How can a doula support a mom in a VBAC best?
The answers are too long.
I think moms need to know that doulas do not take their power away from them. Doulas are there as supportive, and I know for my husband, the doula was there for him, and he says way more than for me. But he appreciated that. He felt like some of the pressure was off of him for that, and that he could support me because she was supporting him. And so, but just to know that doulas can't make those decisions for you, and you still get to be the one to making those decisions. But doulas need to be ready maybe to give options and support.
I think it's really important too that you know that your doula is supporting you, that she's not going to talk you into something or not support your choices because she's afraid. Because that happens too. A lot of times we bring our own fears into a situation, and that's not good.
I do think that it's hard because in one sense, you're supporting a woman in pregnancy and labor. How is she different? So I think it's important to remember that she's still going to have those same fears, and she's still going to have those same questions. And like you do as a doula, if something comes up that you're not yourself well versed with, that you find the information and you give it to them. And I think a lot of women have fear. I feel like VBAC women have a lot of fear. They're filled with fear. And I think it's important to remind them that it's normal and to work through that fear.
I think too, there may be more during the recovery, regardless of whether it was a cesarean or a VBAC. For me, it didn't hit me what I had missed with my 2 cesareans until I had that VBAC. And then I was like, oh my gosh, I missed this. I missed that feeling. I missed holding. I don't remember the first couple of days with my boys because I was drugged out of my mind. And so what I had was the video. And it wasn't really until I had my VBAC that I understood what I had given away.
And don't you feel like that happens every VBAC? I feel like there's always healing. I tell women all the time, you will continue to heal. You will not realize that it was, you won't realize what was taken from you until you have, until you experience it and you realize. And, you know, so the healing isn't, I had a VBAC, oh no.
Great.
Then you're like, wow, I did this, you know, and then comes the self-blame. And
the VBAC doesn't fix the cesarean birth. Like
yeah,
it doesn't take all that away. And
It kinda
I think
makes
one of
sense.
the moms said that in the film, that she was expecting the healing from the VBAC. And healing is I tell people it's like an onion. You do it one layer at a time, and it always makes you cry. Right? It doesn't just all come because you had this beautiful VBAC. Maybe the VBAC wasn't so beautiful. And you know, it isn't until you have that VBAC that you understand what birth is and how hard it is, and it's not all beautiful and roses. It's hard work, and it doesn't take all the stuff away from the cesareans. It just doesn't.
And it's okay. It's okay to have that hurt and that pain. It's okay to feel disappointment over a cesarean. It doesn't mean you're not happy with your baby. It doesn't mean you're not going to be a good mother. It's hard. And it's okay to feel that hurt and that pain. That's important.
Thank you. Does anybody else have anything? No? You guys have anything else? No? Okay, we're done. Thank you so much, you
Come
guys.
up and talk to any
Okay.
of us afterwards, you know, feel free to, if you want to do something more in private, to talk about specific issues that you may be encountering.
I do want to say that every person in here makes a change. Like if we want there to be a change in care for women, you have to make it happen.
And it is up to us. It's the hospitals and doctors aren't going to do it until we stand up and say, we want the VBACs. 10% isn't good enough of a rate for our VBAC moms in this area. And we as moms have to stay